Alberta Rheumatology and the Arthritis Care Team presents exercises for people with ankylosing spondylitis and other spondyloarthropathies. Strength. Disclaimer: spinal fusion affects your movement in many ways. If you have fusion or suspect you do, please speak with your healthcare provider prior to proceeding with the exercises in this video. Thank you. For your information, the following video is to be used for reference only. It does not indicate the quantity or resistance that is recommended by your healthcare provider. Please refer to the guidelines for how you should implement strengthening into your routine. Guidelines for strength exercises. Only do these exercises on the advice of your healthcare provider. Do these exercises 2 to 3 days a week with rest days in between. These exercises should not affect your sleep, and you should feel back to your baseline by the next day. Start with body weight or low weight. Start with low reps of one set of 5 to 10 reps and gradually increase over a few weeks. Once you have reached 3 sets of 10 reps, you may go up in weight. When you increase weight, return to one set of 5 to 10 reps and start the cycle again. Before you lift your hips off the ground, squeeze your buttocks and press through your heels. Then lift your hips slightly off the ground in line with your thighs. Hold and then slowly control your hips back down. To progress, lift one leg, keeping the bridge stable. Do not hold your breath. Keeping knees up, alternate bringing one hand back towards the ground. Keeping arms up, alternate bringing one leg straight towards the ground. Do not arch. Alternate bringing one arm back with the opposite leg going straight down. Keep your lower back pressed into the ground. With your hips and your knees slightly bent, lift your top knee. Foot and kneecap point upwards. Keep your pelvis stable and your heels together. Do not let your torso roll backwards. With your hips and knees slightly bent, lift your top foot away from your bottom foot, keeping your knees together. Do not let your torso roll forwards. Straighten your top leg. Lift your whole leg from the hip. Keep your toes facing front. You will feel this in the side of your hip and your buttocks. Press up through your knees and your forearm, keeping a straight line from your knees to your head. Then lift up on your hand, keeping a straight line from your knees to your head. Knees straight, pressing through your feet that are stacked. Press through your forearm, keeping a straight line through your torso. Then come up through your hand, press through your feet. On your forearms and your knees, squeeze your bum and keep your core tight. Keep a straight line from your knees to your head. Then move up onto your hands, once again keeping a straight line from your knees to your head. Then press up through your toes and your hands, keeping a straight line. Moving to your toes, press through them as you press through your forearms, keeping your whole body in a straight line. Tuck your chin, look down and lift your head off your forearms. With your arms by your side, squeeze your shoulder blades, look down and lift your upper torso off the ground. You may also lift your hands slightly. To progress, you may clasp your hands behind your back as you lift your upper torso. When you lift one arm, remember to keep your head down. Only go as far as you can before there is pain. Squeeze your shoulder blades and lift both arms off the ground. Squeeze your buttocks and press your hips into the ground. Straighten your knee and lift your whole leg from the hip. Remember to keep your pelvis on the bed. As an option for Superman, you can lift your right arm and your left leg together, and your left arm and your right leg together. Another option would be to press your pelvis into the ground, remain looking down as you lift both your legs and your arms off the ground. As you lift your arm, press through your hand and both knees. As you lift your leg, press through both hands and your other knee, lifting your right arm and your left leg together, and your left arm and your right leg together. Thank you from the Arthritis Care Team at the University of Alberta Hospital.